Our webinar for this month is mental health support in schools. Just a couple of things to mention. My name is Esme Hollier. I'm the marketing exec for the AIM Group, and I'm joined by Aaron Cadby, who is our marketing assistant. We have a bibliography at the end, so you can view all the resources. We've linked them back to the articles we found and also kind of look at some of the facts that we found while we were doing some wider research around the topic to kind of top up our own knowledge. And I really do think it's worth kind of looking through those links because there are so many facts and interesting points that we weren't able to include because it is such a vast topic. Just also to note, we will also have a question time. So if you did have any questions about any of the subject matter or anything else, then you're absolutely welcome to ask us a question. So on your screen, there should be a Q&A section. If you just pop your question into a box, we'll be able to see them. And what we'll do is we'll answer them anonymously. So we won't say who you are. We'll just say, someone's asked us a question surrounding the topic. So let's get started.
So our main points for discussion today, we'll start off talking about the crisis in general and the impact this can have on staff, other students and families. We'll then explore how we can work together to create positive change, and finally we'll end with our Q&A discussion so you can ask any questions you may have. So our introduction was based on the crisis in numbers, the general mental health statistics, the mental health issues and their link to pre-existing conditions, mental health in the social media, the stigma surrounding males and mental health, and the impact of mental health issues and others, cuts to the public sector mental health services, and our main points will be how teachers, parents and schools can work with us to properly support all students in their care. And then we'll also include our fully funded level 2 accredited courses which are specific to educators and the mental health crisis. And we'll do a breakdown of each relevant course, benefits, testimonials and statistics, and we'll conclude with a Q&A and the next steps. So, it's no secret that there is a mental health crisis growing across the UK amongst all age groups. It's also no secret that mental health professionals are spread thin and that people seeking treatment from the NHS are often waiting months, sometimes even years, before help is available to them. There are also very few early intervention initiatives available. More of these could prevent mental health issues from developing and growing beyond a mild condition to a much harder condition to treat or manage. Students spend roughly 190 days a year in school in the care of teachers and support staff. Some may even spend more time with educators than their own parents or caregivers. Because they are so frequently in the care of the school, it's really important that all staff members understand the statistics surrounding mental health disorders, how you can tell if someone is suffering from a mental health disorder, and how to support students. Early intervention is one of the most important factors when it comes to treating or managing a mental health disorder and minimise the impact it can have on the student's everyday life, both short and long term. According to a survey by NHS Digital, 1 in 8 5 to 19-year-olds had at least one mental health disorder when assessed in 2017. Specific mental disorders were grouped into 4 broad categories: emotional, behavioural, hyperactivity, and other less common disorders. Emotional disorders were the most prevalent type of disorder experienced by 5 to 19-year-olds. Rates of mental disorders increase with age. 5.5% of 2 to 4-year-old children experience a mental disorder compared to 16.9% of 17 to 9-year-olds. 1 in 20 5 to 19-year-olds met the criteria for 2 or more individual mental disorders. Emotional disorders have become more common in 5 to 15-year-olds, up from 4.3% in 1999 and 3.9% in 2004 to 5.8% by 2017. The increase since 2004 in emotional disorders is evident in both boys and girls, yet 70% of children and adolescents who experience mental health problems have not had appropriate interventions at an early age. To add to these harrowing statistics, we feel it's important to note that 2017 was the last time an authoritative government body did a survey of mental health disorders amongst young people specifically, and many people feel the crisis has grown, so there is a likelihood these figures are more dire now than they were 2 years ago.
As well as emotional mental health disorders, such as anxiety and depression, many experts feel there is a link between pre-existing mental health disorders, such as ASD and learning disabilities, and those that develop throughout a child's life. On this slide, we'll be looking at mental health and the links to pre-existing conditions. So, is there a link? According to mental health nursing of adults with learning disabilities, people with learning disabilities usually have multiple mental health problems. This could partly be attributed to the environment in which people with learning disabilities are often placed. It's quite common for mental health needs not to be recognised as a separate health problem, and in some cases are attributed to their learning disabilities. This results in unnecessary suffering, which could be alleviated with the right care and support. According to the UK Parliament, 2010, achieving equality in health and social care and education does not permit the assumption that one size fits all, because reasonable adjustments, as outlined in the Equality Act 2010, are necessary to accommodate individuals' disabilities. The problem is that when it comes to putting this in practice, schools usually have very little budget to educate all of the staff on these needs, meaning often staff are left without the knowledge they require to best help the students in their care. Additionally, mental health problems in children with learning disabilities can be overlooked due to communication difficulties or a lack of insight into their emotions or feelings. People with learning disabilities demonstrate the entire spectrum of mental health problems, with higher levels than those found without learning disabilities. Those individuals that have pre-existing medical conditions, such as autism, anxiety, depression, and personality disorders, are often left at a disadvantage, are let down by the education system, and can be more likely to develop mental health issues at earlier stages in their lives if their particular learning needs are not picked up or noticed. Studies have found that children with ASD, or an autistic spectrum disorder, are at a much higher risk of developing a mental health problem than the general population. According to Lunagard, 70% of children with ASD will have a mental health concern at some point in their lives. It is clear that pupils with pre-existing medical conditions such as autism and learning disabilities tend to be more susceptible to mental health problems at some point, and more training and knowledge needs to be delivered to teachers, parents and carers. Social media can be a powerful tool with both negative and positive implications depending on how it is used. However, in a world dictated by Instagram influencers, hashtags and fake news, there is a real danger that can occur when social media is not used properly. According to Forbes, on average, Gen Z, aka people aged between 4 and 24, spend between 6 and 9 hours per day consuming media. Apparently, they also use an average of 5 screens, a smartphone, a TV, a laptop, a desktop and a tablet, switching among them for different purposes. That's a staggering 42 hours a week. This all-consuming approach to social media has some serious mental health implications, from body image issues stemming from consuming the content of unattainable Instagram influencers who diet using dangerous use fads whilst preaching positive body vibes, to developing a likes obsession, where people delete content if it doesn't get a certain number of likes after a certain amount of time, and everything in between. Gone are the days where you could find some safety and comfort in your own home, the days of obsessing over glamorous models in magazines that could be put down or thrown away, and where bullying was limited to the playground. Social media infiltrates every aspect of the Gen Z lifestyle, and in doing so is continuously nibbling at the self-respect of young people across the globe. We have broken down this section into 3 sections, realising that it is such a huge topic we definitely weren't able to cover all bases, but we decided to hit the problems that teachers speak with us most about. Cyberbullying. Cyberbullying is perhaps one of the nastiest forms of bullying, as it spreads very far, very quickly, is difficult to contain, and the effects of a digital footprint can remain online for years to come. It is also completely and utterly consuming. Students can't run away from it or hide at home. It infiltrates a network that the students once found safety and positive reinforcement in, and destroys it. Part of the problem, of course, is that a virtual network can carry so much weight in terms of deciding whether a student respects themselves or not, but that's a conversation for another day. Additionally, teachers and parents face a problem in that they are not part of the network this happens in, so often it can go unnoticed for weeks or even months. According to ditchthelabel.org, an international cyberbullying anti-bullying charity, around 5.43 million young people in the UK have been the victims of cyberbullying, with 1.6 million people suffering extreme cyberbullying on a daily basis. That's a huge number of students battling constant ridicule, embarrassment, harassment, and having to filter through negative comments on social media. From body image to racism and homophobic remarks, there's a huge scope for what cyberbullying can include. Next, we look at suicide-inducing games. The second most common thing we speak to teachers about in the remits of social media are self-harm or suicide-inducing games, where people are given challenges to start off by causing mild self-harm to themselves, right through to suicide attempts. They work off a chicken or a dare basis and infiltrate seemingly harmless thought-out chats, slowly building up trust and grooming someone until they willingly do as they're commanded, or the user can threaten the student. For example, if you don't do X, Y will happen. The most infamous examples of these are the Momo and Whale game, which have, according to The Sun, both been linked to a string of deaths, not only in the UK but across the world. The likes obsession. The likes obsession focuses on the premise that when someone likes a post or picture on social media, that tells our brain something positive has happened. Over time, this becomes addictive, encouraging people to spend more time obsessing about what they're going to post on their social media platforms and spending hours getting that perfect Instagram shot. This may seem like innocent fun until fundamentally what this means is people are measuring their own worth entirely based on the premise that people like their social media content. When the reverse happens and someone who has fallen spell to the likes obsession isn't having photos liked, they can feel dejected, embarrassed, very lonely, and even depressed, much like if you were speaking to someone in real life and they deliberately ignored you. This can cause them to delete the post and obsess over what they can do next to hit that high feeling they get when lots of people like their posts. Some of us may know someone like this, or have even been there themselves, and on the surface it may seem harmless, but we feel there is an obvious connection between this behaviour and depression, loneliness, anxiety, poor body image, and a lack of self-worth, which can lead to more dangerous health issues, such as eating disorders, self-harm, insomnia, and more. Parents may not notice an obsession with social media growing, or even realise how much their child is being affected by social media. Part of the focus of the Children and Young People's Mental Health course is around ensuring that you can spot the signs in a child's behaviour if they start to develop a mental health condition due to external factors, such as bullying, social media, troubled times at home, and a range of other changes in a young person's environment.
Although mental health can impact anyone at any stage in someone's life, men tend to have more of a stigma surrounding mental health due to gender stereotypes that men don't cry or should be strong and dependable. In recent years, many organisations have started to break down these stigmas, but it's still common for mental health literature across the board to both be written by and aimed at women. According to the Office for National Statistics, 75% of those who take their own lives are men. This is the biggest cause of death for men under 50 in England. And it's reported that 12.5% of men in England are suffering from at least one mental health disorder. Additionally, if you consider that 73% of adults who go missing are men and 87% of rough sleepers are men, the overall picture of mental health of men begins to look vastly different about women. Due to cuts in the mental health services, there are very little prevention schemes available across the board, including in schools. Perhaps the scariest part of mental health is invisibility, and boys and men tend to be much less vocal about mental health problems than girls and women are. The general stigma towards mental health issues are slowly being lifted with the help of celebrities coming forward to share their own mental health experiences. Prince William was very public about how his mental health deteriorated when his mother passed away. Dwayne Johnson often speaks about his mental health issues, and Ryan Reynolds, Stormzy and Brad Pitt all suffer or have suffered from depression. The more mental health is spoken about and recognised at an early age, the more likelihood there is for prevention of self-harm, drug and alcohol abuse, eating disorders and extreme cases, suicide. Our courses can enable you to recognise the symptoms and reach out to a young person who you believe may be suffering in a constructive way, perhaps preventing further negative mental health implications. Although poor mental health and mental health disorders have an obvious impact on the person who is suffering, they also impact those around them, from family members and friends to teachers and classmates. A mental health disorder that is not being managed properly can impact many people in the community. In this slide, we are looking at the impact that mental health issues and how the lack of funding to support teachers can have on students and the teacher in the classroom. We are facing a mental health crisis in our classrooms, and it is estimated that in every classroom, 3 children will have a mental health problem, and around 1 in 12 young people deliberately self-harm. The rate of depression and anxiety has increased by around 70% in the past 25 years, and the number of young people calling childline regarding their mental health has risen by around 36%. Throughout their education, children will have spent 7,800 hours in school. With such a massive amount of time spent in class, it is clear that schools can provide and create the perfect environment for promoting good mental health and identifying the early signs of distress or changes in students' behaviour. The current school system is an unbalanced one in terms of the focus on just gaining qualifications and passing exams. However, there needs to be more focus on the mental health and well-being of students. The skills, knowledge and behaviours that young people pick up when they are in education can set out how they will manage their mental health and emotional well-being throughout their lives. So it's vital that good practice are put into place for educators so they can teach good social and emotional skills to students. Many young people found that stress at school tends to be one of the main factors that can contribute to their mental health. This could be due to the lack of understanding, stigma surrounding mental health, exam stress, bullying and limited counsellors and support. According to an article published by The Independent in October last year, schools are not encouraged to promote and prioritise good mental health due to increasing funding cuts which are leaving vulnerable children at risk. As mental health, along with teaching assistants and support staff with mental health training, tend to be the first resource to get cut. There are no government-led incentives or funds to push schools into providing the resources or time to the well-being of students. As a case in point last year, children aged 5 to 17 went to Parliament to tell them directly how the budget cuts had affected them. One girl among many, Elodie, aged 17 from Nottinghamshire, who suffers from anxiety, said, "There was one counsellor, one which I wasn't allowed to see as she was stretched as it was, and my needs weren't dire enough. I had been trying to be seen since year 8, just 13 years old, but I hadn't tried to hang myself or taken a blade to my wrist like many of my peers, so my needs weren't urgent enough to be seen." Children told us stories about parents donating funds to cover costs and valued TAs, counsellors and SEN staff being cut. Furthermore, lack of funding has made it hard for schools to even employ one counsellor in some instances, or the training that teachers had was inadequate or ineffective, according to a survey of teachers and educators conducted by The Guardian. When a student or multiple students are showing signs of distress and poor mental health that is not recognised by school staff and parents, it causes a ripple effect and causes worry and upset for other students in the classroom or year group. As well as disruption to learning and a general negative atmosphere in a learning environment, it can also trigger students already battling mental health disorders and have a severe impact on schools and the wider community when a student has to be removed from school due to poor mental health or commit suicide.
Budget cuts to the public sector and mental health services are continuously putting more pressure on teachers, educators, parents and carers to pick up slack from where there is little to no help from the government. We all realise that most staff in schools already go above and beyond for our children, and from looking after them in a pastoral sense during school hours to making sure that their needs outside of school are met. According to our research, in 2013 there was one mental health doctor for every 186 patients. In 2018, this has fallen to 1 for every 253 patients. In 2013, there was 1 mental health nurse for every 29 patients. In 2018, that fell to 1 for every 39 patients. Additionally, the number of beds for mental health patients in England has decreased by almost 3,000 since 2013. Insufficient and underfunded services mean that stress is being put on staff who may feel they're not trained or qualified enough to tackle many of the mental health or changes in behaviour that may arise. Some struggles that schools, parents and educators are currently facing include increased budget cuts, which make it hard for teachers or educators to properly support their students. Already strained staff having to take on additional responsibility of students' mental health, while not necessarily understanding the disorder or best course of action. Parents may not understand mental health, meaning that support in the classroom is left behind when a child returns home, leading to strained parent-child-family relationships and frustration from teachers trying to help a child. To add to the mounting pressure, social services are also snowed under due to budget cuts, and now there is almost a vacuum in the services that schools and parents have traditionally relied on. We have a real passion about early intervention because we know from previous experience of talking to many members of staff from schools on the phone across England that suicide is becoming more and more common, particularly amongst males who are considered to be jovial and bright young people. From the notorious whale and Momo games which swept across the internet to mounting exam stress and cyberbullying, we are noticing more of an increase in these kinds of incidents being reported. Many of our staff members also know firsthand how losing a friend to suicide can affect them and their class group from experiencing it firsthand while they were at school. With evidence that although awareness of mental health is growing, the number of mental health cases are still set to rise, it's apparent that this crisis is only going to get worse. Companies like ourselves and other campaign groups, often in the third sector, are filling the void to help schools and offer guidance, support, and putting schools into contact with training providers to make it easier than ever to upskill teachers, school support staff, and parents at no cost to them. So, how can teachers, parents and schools work with us to properly support all students in their care? It's a question teachers and school support staff are asking themselves more and more as mental health illness rates increase and school budgets decline. The answer is to work with companies like the AIM Group to create positive change, not just in your school, but in your community. The problem with many courses and resources for schools is that they can often be costly and or time-consuming. Our accredited Level 2 courses are up-to-date qualifications funded by the government and written by a trusted training provider. They allow teachers and parents to upskill themselves in their own time whilst learning about a mental disorder that is applicable to someone in their care. They then allow the learner to identify mental health disorders and put actions in place to benefit the child. This early intervention can stop a mental health disorder from having such a large impact on someone's life and even prevent potential added mental health problems, creating positive change, not just for the student, but to all of those around them. The benefits for both staff and parents of these courses is that first and foremost, they will have a greater understanding of mental disorders as a whole and the signs to look out for, allowing you to be proactive rather than reactive. It's crucial to remember that it's not just SENCO and safeguarding staff who come into contact with children suffering from a mental health disorder. From teachers to reception and administrative staff to heads of year and TAs, there are so many people one single child can come into contact with. So it's crucial all staff are able to identify mental health disorders as they begin to develop. A good example of this is one of our BRQ team members, Liam, works with a school that had 30 staff complete the Understanding Children and Young People's Mental Health qualification. Upon completion, they've now made these 30 members of staff mental health champions. This means that students have a whole team of teachers they can speak with that are knowledgeable on the different things that may be affecting them.
These courses are designed for both staff and parents to complete a self-study, either online or paper-based, over a 6-week period. They also are applicable for anyone wanting to gain a further understanding whether the children staff care for are showing signs of SEN, or for parents who want to gain an understanding of different challenges children are facing prior to this leading to mental health issues. The courses cover a wide array of subject matter. For example, the Understanding Children and Young People's Mental Health course covers subjects such as anxiety, self-harm, suicide, transgender, eating disorders, cyberbullying, and many more, all of these being relevant within mental health in children and young people in a modern context. Everyone is eligible to do one of these courses, so long as they are over 19 years of age, have lived in the EU for 3+ years, and there are 12 people to place on the course. The reason for this is that we require a minimum amount of people to induct, as someone has to come and visit your site to do the paperwork. As a company, we believe a major contributing factor to the mental health crisis is the lack of identification when someone becomes mentally unwell. We feel that early intervention is key for helping to prevent mental health disorder from developing into a more serious illness. These courses about mental health disorders allow you to take the first step towards preventing the problem, but the other 6,144 people we work with have done, for helping you to identify a negative change in someone's mental health, so you can make a plan of action to best support students in your care. These courses are online, ensuring you can learn at your own pace in your own time. You have 6 weeks to complete them, and it's estimated they take between 12 and 18 hours to complete. They are Level 2, NCFE or cash accredited and fully funded, meaning they are free. We have 33 courses in total, all of which can be researched about and signed up for on our website. But we thought it would be best just to say a few words about the one we felt were most relevant to you. The Mental Health Awareness course is a fully funded Level 2 qualification split into 4 units. This course helps to develop your understanding of the different mental health conditions, from the different triggers and signs to how mental health can affect an individual's ability to function and how you can support an individual with their illness. There are other factors that can affect a child's development and learning, such as autism, learning difficulties, and learning disabilities. It is important to understand that as these individuals can also be at risk of developing mental health concerns.
Understanding learning disabilities is a fully funded Level 2 qualification split into 6 units. Those individuals with learning disabilities are less likely to understand their symptoms, which is why for those that work with these individuals, it's vital for them to have a good level of understanding of the signs and symptoms of the various conditions that come with learning disabilities. and also that they are aware of the laws and legislations of the healthcare system in order to deliver the best support. This course improves your understanding of the term learning disability whilst giving you the knowledge of the importance of safeguarding these vulnerable individuals from abuse.
Children's and Young People's Mental Health is a fully funded Level 2 qualification that's split into 5 units. Mental health problems affect 1 in 10 children and young people. It is an issue that has been spoken about, researched into more than before. However, many people, especially educators, feel they don't have the right knowledge or skills to support young people properly. This course is specifically designed to give you a broad overview of the different mental health problems and how to support young people who are suffering from them. From anxiety to cyberbullying to depression and more, it's essential for teachers and anyone who has children in their care to understand mental health in young people and children.
Specific learning difficulties is a fully funded Level 2 qualification split into 5 units. Around 15% of people have a learning disability. It is then vital for those people working in healthcare or education to have the right knowledge of various learning difficulties like ADHD, dyscalculia and dyslexia, and how the specific learning difficulties can affect children in different ways. It is also important for teachers, parents and carers to know how individuals can be supported through their employment journey.
Understanding Autism is a fully funded Level 2 qualification split into 6 units. This is one of the longer courses as there is much to learn and understand, from support, communication, social interaction and sensory processing and positive behaviour. Autism is a spectrum condition that affects how a young person interprets the world around them and how they communicate and interact with others. Statistics show that around 700,000 people in the UK with autism, more than 1 in 100. It's important that in schools, educators have a clear understanding of the misconceptions as well as the support around autism, especially when it is linked to mental health, and vital to ensure that those who have these individuals in their care are aware of what it is meant by autism and how it is diagnosed.
The AIM Group and our training providers strive to equip schools in the UK with the expert knowledge they require so they can quickly recognise the student in need and take immediate effective action. All of these courses are Level 2 nationally recognised qualifications and will enable you to gain an understanding of the subject matter and provide you and your team with the ability to support young people with an array of mental health disorders in an effective manner. You can change lives for the better by promoting prevention and positive change, by being proactive rather than reactive. As well as training your staff to notice changes in students' behaviour in order to action early intervention, there are also many other useful resources available to help your students and staff in a time of crisis. With waiting lists on the NHS being as long as 18 months, we felt that the awareness of other impartial services was an essential tool in order to action positive change. Some useful services include CAMS. So CAMS are a multidisciplinary team that focus on the needs of children and young people. We've inputted a link to the NHS about the specifics of their service, but if you wanted to refer someone to CAMS in your areas, simply type CAMS followed by your area into Google, click on the relevant link and there will be a referral section you can use. IAP services. IAP services provide access to a wide range of talking therapy treatments for adults with common mental health problems. If you're working with a student 18 plus, or potentially a staff member who's suffering with a mental health problem, this could be a really useful tool for you. Simply Google IAPs and the area you're in to find the IAP service closest to you. CHR team or crisis teams. Crisis teams should only be used in emergency circumstances. They support people who might otherwise need to go to hospital, for example, due to psychosis, severe self-harm or suicide attempts. They usually include a number of mental health professionals, such as a psychiatrist, mental health nurses, social workers and support workers.
Other useful services include Childline and the Good Samaritans. So as well as providing free immediate chat counselling services and a phone call service, Childline is also an excellent resource for students and teachers alike. From games that are designed to alleviate stress to useful articles and activities, Childline is always on hand to help. Their website is childline.org.uk. The Good Samaritans is a 24/7 phone service which is specifically designed to prevent suicide. They receive a call every 6 seconds and they're open 365 days a year. Head on over to samaritans.org for more information. As well as some useful services available, there are also a number of great resources you can use to expand your knowledge of mental health. Mind is a charity that provides advice and support to empower anyone experiencing a mental health problem. They campaign to improve services, raise awareness and promote understanding. They are a great resource for information about different mental health disorders and how you can support someone. Mind.org.uk is their URL. The Mental Health Foundation have prevention at the core of everything they do. They have some great blogs, articles, reports and podcasts about different ways they are looking to tackle the crisis, and some excellent publications that can be used as a tool by staff and students alike. Their website is mentalhealth.org.uk. So there are some of the many testimonials that we received from individuals, organisations and schools. So I'm just going to read out the first one. This is from a senior leader from Bristol Hall Academy. As a senior leader at Bristol Hall Academy, responsible for student welfare and safeguarding, I'd like to take this opportunity to express the valuable contribution the Level 2 course in mental health in young people has made to our academy. When AIM offered the course, we embraced the opportunity and put the pastoral team forward for training. We then decided to offer the training across the academy, which resulted in 30 members of staff successfully completing the training. From this, the Mental Health and Wellbeing Champion Initiative was born. We now have over 30 wellbeing champions who have the expertise to successfully support our young people, be a point of contact during times of crisis. The regular support and consistency a wellbeing champion can offer has already proved valuable in supporting students who are facing mental, emotional, social challenges that are or could impact their education. We pride ourselves on the outstanding care we offer our young people, and we believe this to be a platform for success. Our Progress 8 data indicates we reach the most disadvantaged young people and offer them every opportunity to succeed despite adversity or disadvantage. This initiative, resulting from the training AIM offered, can only support that endeavour.
So next we come to our bibliography. So as mentioned before, you may find these links really useful to look through in your spare time. And as mentioned before, we will definitely be sending the full presentation with our speakers notes in for you. Just to note, we could only include so much content. We know there are so many more aspects to mental health that could be covered. And some of these do cover wide areas than what we're able to speak to you about today. So now is the time to ask questions. So if you'd like to ask any questions, please use the Q&A box provided and type them out. We will read them anonymously and then do our best to answer them. So what I'm going to do is give you guys just a couple of minutes to maybe come up with a few questions you might like to ask. And then we'll read them out and we'll read our responses to you as well, and we can go from there. Okay, so we've had a couple of questions come through. So one person has asked what units the children and young people's mental health qualification covers. So we're going to speak you through the units.
So it's based on 4 units. So the first unit is understanding children and young people's mental health and context, and it's understanding factors that may affect children and young people's mental health, and then it's understanding children and young people's mental health concerns, and then it's understanding the impact of children and young people's mental health concerns, and understanding how to support children and young people with mental health concerns.
Yeah, so we just pull up the exact breakdown for you so you can see what the exact units were. So obviously, as mentioned before, within this it covers a really wide array of topics from, sexuality questions to bullying, social media, and kind of everything in between. Someone's asked us, can you give us addresses for the funded courses of different qualifications, please? Absolutely. What we'll do is when we send you through the presentation and the YouTube link, we'll attach the URLs for each of the courses, and then I'll also put in the contact details of the qualification executive in your area. So if you want to speak with someone, you're getting through to the right person immediately rather than being passed down lots of different routes, which, as we know, isn't a great time spent for everyone. Someone else has asked, what is the school and local council's responsibility regarding children when school life is causing extreme mental health? That's a really good question. From a legal perspective, I wouldn't know. From a pastoral perspective, obviously, anyone with children in their care has a responsibility to look after them, whether that's in a teaching sense, where you have that kind of responsibility as a chaperone to a child, or whether you're a caregiver. As the council, obviously, they have a responsibility to the people in their jurisdiction to do the best they can in terms of funding. I think it's definitely something we would have to look into more in terms of the exact legalities and can definitely get back to you on. But I think, I think that council should take more responsibility. We know from speaking to teachers how hard it is at the moment to try and get funding to do courses and have resources to really support students, not just in mental health but across the board. And there is only so much you can do. And I think in schools your responsibility is to do the best you can for the children in your care. And if you're doing that, then there's not much more you can do. It's a bit of a wishy-washy answer, definitely, but if anyone else would be interested in, kind of some more research being sent to them about that, then please just let us know in the Q&A and we'll include you in the research we send back.
So someone else has asked, have you ever had anyone fail the course before? The answer is no, because if they do fail the first time, they are told which questions they need to work on, and they can just go back and redo it until they pass.
Yeah, so it's a really good learning tool, really, because obviously at the end of the day, as much as it's great to get a qualification, in a practical sense, understanding all the units is essential. So if for whatever reason they feel like you haven't provided enough written evidence that you do understand an answer, as Aaron mentioned, you do get to go back and do it again. So someone says, do you think that students having poor mental health affects teachers and school staff? Definitely. I mean, imagine, I don't know, I think even just as a human being, looking at another human being and not really knowing how to help them or what the cause of the problem is scary and, of course, very upsetting. And then for that person to be in your care must be even worse. And I really do think, we talk a lot about children and the mental health crisis growing, but that can only have a detrimental knock-on effect on people around them if they don't have the correct tools to help them. And I really think that being able to take that first step is essential. Being able to identify what a child is going through will alleviate a lot of stress from students, because if they're able to identify it, they can make an action plan with the school counsellor or the safeguarding team or the SENCO or whatever process it is you have in your school, as well as working with the student's parents to kind of give the best course of action to that student. And I think that kind of presents a happier outcome for everyone. There's nothing worse than looking at someone who's suffering and having no way of helping them. So absolutely, I would say it affects teachers and school staff, because obviously, you invest a lot of time and care into students. So anything they're going through will directly affect you in one way or another.
Another question is, we have some concerned parents. Are they able to take the course? Yeah, absolutely. Obviously, we recommend anyone with young people or children in their care to take the course. So yeah, parents and teachers, everyone can do it.
Yeah, we kind of encourage it as well, because obviously, like we mentioned before, it can be frustrating for teachers if they're on a course of action with a student, and then, that student is going through something and, the teachers put an action plan in place, and then that student goes home, and all the work they've done throughout their day can unravel if the parent at home doesn't understand or isn't able to facilitate that child's needs. So definitely it's something we encourage. Every school is different. Some schools love it. Some schools would much rather kind of keep it in-house. Some schools, work very, very closely with their parents. Others will kind of, communicate in a less direct way, such as through email. It really just depends on, what the best protocol is for your school, but also for that parent. Obviously, we understand that parents work very long hours often, to be able to feed and clothe their children. So it's not always a situation where a parent can come in and be directly involved. But I guess the really positive thing about these courses is that you can do them online in your own time. So once that induction is done, you can do them online in your own time. You can do one course at a time. But once you finish one, you can do another course as well. So, it's a really wide opportunity, I think, for there to be positive change kind of on the community through education and supporting one another, that's for sure. Someone has asked us, doesn't legal responsibility lie with the local safeguarding board in the first instance for each local authority area? Yes, as far as I am aware, it's not something I'm hugely well versed in, I have to admit. I kind of know more about the mental health side of things and obviously our courses rather than the legalities, which is why before I said, it's something we would have to look into. But as far as I understand, obviously, that there are protocols in place, and they're put in place so that if something does happen, there's a clear pathway, so you kind of know who's responsible for what and where each legality lies. I just wouldn't know the exact ins and outs of that. So it's a really good question, and again, it's something definitely look into and send back to you. I would imagine that our qualifications executives have much more understanding around the legal legislation than we do. Obviously, working in the marketing department, we cover a real vast array of topics. So I do know that they're much more kind of versed in school protocol than Aaron and myself would be, but we're always willing to learn, and obviously it's something that it's important for us to learn. So in the future, if someone was to ask us, we could tell them. Did anyone else have any other questions? I'll give it a few minutes in case anyone thinks of anything. Someone's asked, if the NHS can't help a student with counselling for a number of months, what are we meant to do then? That's a tricky one because obviously a lot of responsibility lies with the parent. It's definitely a conversation you have to have with them, but hopefully some of those resources in this webinar were helpful. For example, Childline and CAMS and being able to refer someone I think it's definitely a process that the parent would have to do. I don't think obviously it would be wise to go over a parent's head, but absolutely some of those resources are really helpful, and just gives the child someone to talk to, even if it is Childline, because CAMS have a number of months on their waiting list. At least they have counselling and support coming to them when they need it before they are able to access kind of continuous sessions of talking therapies, and kind of other things around that as well. Someone says, can EHCP plans be issued for mental health solely? Again, a really good question. I actually am not 110% sure on the answer to that, but as we can see, everyone who's asked questions, what I will do is look into that and again let you know. This is really good for us because it provides us with a really clear learning curve of things we need to learn and things that are important to our schools who are obviously looking to learn more about mental health and support their students. So definitely something we can look into and get back to you on, but I couldn't answer that right now as it was. We'll just give it one or two more minutes and then think about wrapping up. So if anyone else has any burning questions. The other thing is obviously to note, if you did have any questions and you don't want to ask them now or you think of them later on, please send them to us. And as I said, we'll do our best to answer them. And if we don't know, we'll always go away and research and come back to you. It's really important that we're not just here saying these are courses and they're great, which obviously they are. We are actively a business that really wants to support schools in their endeavours and help them with this. It's something we feel very passionately about, so we will do our utmost to get you the answers that you're looking for. Okay, I can't see anything else coming through, so what we're going to do is wrap up question time, but again, please email us if you have any other burning questions.
So, sort of the next steps. We promote these courses to actively give teachers valuable resources, set the first step in fixing the mental health crisis in schools like yours, by giving you the tools to identify key mental health disorders and intervene at the first stages of a mental health disorder developing. They won't solve the problem, but they will allow you to identify a mental health disorder developing, enabling you to work with the SENCO, safeguarding or pastoral team on developing a plan of action for a child in your care. Please get in touch for more information on our website, that's theaimgroup.co.uk, or emailing qualifications@theaimgroup.co.uk, or you can call us at 01245 392 075. All contact details are also available on our website and in the email I sent you, inviting you to attend the webinar. Thank you so much for your time.